All right, we have this last segment with Dr. Cynthia Snyder from Cone Health. She's answering your questions about COVID spread, about flu, about all kinds of respiratory illnesses. In fact, this question is asking about RSV. So this person is asking, do adults need to be concerned about RSV, or is it just children?
So, adults can also get an RSV respiratory infection, and commonly I think parents get it from their kids. So if you happen to live in a household that has RSV, it's important to mask because you're considered exposed, right? And then you could continue to go on with your activities, and it's usually supportive care. And but if your child has or if the adult has has difficulties with breathing or worsening cough, it makes sense to be seen by your medical provider.
So some folks out there may not even know what RSV is and how it differentiates from like a cold or a flu. So can we just quickly go over that?
Sure. It's commonly it's a childhood respiratory infection we see, and especially in young newborns, they are at risk of having respiratory distress, requiring to be hospitalized and potentially intubated. Right now, nationwide, we're seeing unprecedented waves of RSV in the community, and typically, people can have like really sudden onset of fevers, chills, cough, and shortness of breath. It's probably not as severe in adults, but if you're immunocompromised, that tends to be a little bit more significant.
Okay. Someone is asking, can you review COVID isolation guidelines? So let's say you do have a coworker or a family member that has COVID. So then what happens?
So if you are exposed to COVID, I think I would say like the socially conscious thing to do is to wear a mask, and you don't necessarily have to stay home in quarantine. You can continue with your daily activities, but wearing a mask for the next 10 days. If you can wait to see if symptoms show up, to get tested, but alternatively, you can test after day 5 of isolation to see if you've converted over.
Okay, and so, things have changed too of when you say you're exposed. So what would you consider exposed? Is it just someone in the building that has it, or is it someone that you're sitting close to for a while?
Yeah, so it's usually somebody that you're sitting next to for a period of even like 15 minutes if it's in a closed space. I would say folks who live in the same household have a higher risk of contracting COVID because it's still very contagious. And however, if you found out that you're one of your coworkers and you were in a lunchroom, but greater than, for further away and not necessarily spending that much time with each other, that's probably not a significant exposure.
Okay, and then really quickly, we've got about a minute long. Someone is asking about the time span after getting COVID. How long do you need to wait to get your booster?
Some people can, you're thought to be immune, have a sufficient ramp up of your antibodies for anywhere from 2 to 3 months. But we've started to notice people getting reinfected at 3 months because of the different subvariants in the community. So it probably makes sense to get vaccinated at that 2-month mark or before.
The 2-month mark, right? So don't even give yourself a chance to possibly get it again. All right, thank you so much for your time and your expertise. We appreciate it. You can find a full recap from today's Q&A on WFMYnews2.com in just a few moments. Click in the Who Wants to Know section.